Hi, good morning. How are you?
Good morning. I'm doing well, fine. Thank you.
That's good. So, first of all, thank you for joining us today to talk about sexual health topics. We're basically doing this conversation just to help give some clarity, give some knowledge, give some insight, awareness to our supporters about sexual health topics. Any questions that they had, we asked our Instagram followers what did they want to talk about for sexual health. So to start off, my name is Biana Lormose. I am the Community Health Program Coordinator for the Family Wellness Department of the YWCA. You can go ahead and introduce yourself.
Well, thank you so very much for having me on this platform to discuss sexual health within our population for this morning. It's really a pleasure being here. My name is Shawnette Patterson-Louis. I am a nurse practitioner for maybe 17 years or so. I do work in the inpatient setting at a major hospital, and my primary role there is a transplant nurse practitioner. I also do community initiatives with the mental health patients and disabilities. So that's pretty much what I do in the community, whereas education is concerned and keeping the population informed of public health issues that affect them.
Okay, that's good. It's good to hear that, a woman like yourself, you're doing a lot for the community.
Yes, thank you.
So we can go ahead and jump right into it. My first question is, what is sexual health?
So sexual health, as the name suggests, based on the World Health Organization's definition, is the overall well-being and maintenance of a person's physical, emotional, mental, and social aspects of their sexuality or their sexual lives. It also encompasses a positive and respectful approach to sexuality and sexual relationships. It includes things such as reproductive health, safe
Mm.
sex practices, prevention of sexually transmitted infections, which we're going to talk more about on this forum this morning. It also involves open communication, making informed decisions, and addressing any potential sexual challenges or concerns. Basically, maintaining potential for individuals to lead satisfying and healthy sexual lives. So that's sexual health in a nutshell.
That's great. Thank you for explaining that. So
Yes.
to get more into sexual health, what services do sexual health clinics generally provide?
Okay, so for the community, sexual health is, if we're talking about our population, and it all depends on the region where you are. Sexual health is that, what are you talking about? So some more familiar terms that we are used to when it comes to sexual health clinics, more people are used to those terminologies, or reproductive health clinics. Some of the services that these clinics provide, they are STI testing. And when I refer to STI, the former name STD, so now we've expanded the terminology to include more infections. So it's sexually transmitted infections instead of diseases. So when I make reference to STI, that's what this is, STD. So sexual clinics, they provide STI testing and treatment, contraceptive counseling, pregnancy testing and counseling, sexual education. They provide vaccinations. They provide reproductive health exams. And more recently, they've been providing pre-exposure and post-exposure medications for individuals at high risk for transmission of HIV infections. So that is what you can expect to find at these clinics. They're very comprehensive, and they do a lot of sexual health stuff for our communities.
Okay. So speaking of STIs, how often should someone be tested for STIs?
Well, the frequency of STI testing all depends on the individual, their sexual behaviors, their high risk individuals. My definition of high risk individuals would include persons such as having casual sex, having unprotected sex, having multiple sex partners are using us in these settings. So those are high-risk behavior individuals. If we're dealing with those types of individuals, testing every 3 months is crucial because, of course, these behaviors are high risk. And if you do contract an STI, you want to keep your brain informed, or you want to try to get treatment so you can stop the spread of these STIs. So the earlier the testing, the better. So every 3 months is standard. Then you have individuals who have new sexual partners. So this is my first rodeo and I don't know what's going on. So a person such as this, it's advisable to do sexual testing for STIs every 3 to 6 months in situations when you have a new relationship, if you want to. Persons who have symptoms or concerns, meaning if you're having burning, if you're having discharge, the color isn't staying, if you're having pain, if you're having genital warts, you're seeing things pop up on your body and you're like, I don't know what this is. Well, you know what? You need to come in to get tested again every 3 to 6 months because, of course, we need to find out what the cause is and so you can get treatment immediately. And then there are those who can do annual testing. Annual testing means every year. Sometimes people do these testings on their birthdays or some month that you can't remember because, sometimes we forget all these tests that we have to do. If you're engaging in monogamous relationships that are not high risk, they're low risk, and you know your partner is that only partner, then annual testing would suffice.
Okay. So,
just to be of note here, persons who have, just to go back a little bit, I just wanted to make mention of persons who have HIV or have partners who have HIV. You want to get tested routinely as well, every 3 to 6 months. These are medications that prevent you from having or contracting HIV to some extent, and if you're exposed afterwards. Now, we need to do testing periodically to make sure that you have not contracted the disease or things have not progressed and such nature. So you want to test every 6 months. So basically, every 3 to 6 months for high risk behaviors. Low risk people, every year will suffice. Those things.
Okay. So, speaking of that, do you know if there are any vaccines that someone should get to protect themselves against STIs?
Sure. Yes, there are vaccines that can help with these STIs, but we just need to make some things clear. There is currently no vaccine that provides complete protection against all sexually transmitted infections. However, there are certain vaccines that are specific to certain types of sexually transmitted infections. For example, there's a human papilloma virus that is a STI, and we have the vaccines. These vaccines are provided to both males and females prior to engaging into sexual activities. Then there's the hepatitis B vaccine, and this is available. It is highly effective in preventing the hepatitis B infection that can be transmitted through sexual contact. It is also a standard vaccine that is offered to all infants and adolescents who are at risk for exposure to the virus. So you have those 2 vaccines that's there right now, but remember that this doesn't cover all STIs.
Okay. So besides vaccines, how can someone protect themselves against STIs?
Okay, so besides vaccines, prevention of STIs, as you know, there are a myriad of STIs, and I'll name the common ones that we're used to. Now there are so many more STIs, but we're talking about HIV, gonorrhea, chlamydia, syphilis, HPV, which is a human papilloma virus. You have herpes 1 and 2, herpes 1, herpes 2 down there. Then we have hepatitis B and hepatitis C that they're contracted through sexual intercourse. If you have any broken skin, if you use drug use, all those type of things, IV drug use, hepatitis B and hepatitis C. There's also triple negative vaginosis. So all these STIs, barrier methods are safe and barrier methods are effective. Barrier methods, what are we talking about? We're talking about condoms, we're talking about dental dams for women, condoms for men, then dental dams for women. Getting regularly tested. How can you help yourself? Getting your test regularly tested. Like we just spoke about patients or persons with high risk behaviors versus low risk behaviors. How often should we get tested? Getting vaccinated, for example, against the HPV virus. These viruses can predispose you to certain cancers, and more importantly, sometimes cervical cancer. So you want to get yourselves vaccinated against those things. You don't want to share needles. Hepatitis B, hepatitis C, HIV, you don't want to do those type of things. And of course, good sexual hygiene, keeping yourself clean, those type of things, you know, don't have breaking skin, may not have sex when you have your skin is broken. Those are portals of entry for these infections. So you do those type of things to help prevent yourselves from getting these STIs.
Yeah, that's really important. So
It is.
let's say an individual does have an STI, can it be treated?
Yes, STIs can be treated, and they should be treated to prevent long-term sequelae of problems that can happen if a person goes without getting treatment. As you know, HIV, not treatment, you get opportunistic infections, it progresses to AIDS, and it just replicates and we transmit from person to person if you don't get treated. So yes, there are treatments. Now, whereas the treatments are concerned, you go to healthcare providers for specific treatments based on the specific STI that they've been diagnosed with. Persons who are immunocompromised, HIV persons, women who are pregnant, the medications that they use sometimes for persons infected with these STIs are different from the mainstream population because of the risk to the child, to the mother, and so on and so forth. So yes, there are treatments. Broad spectrum antibiotics such as doxycycline can treat many of these STIs augmented. And also your antiretroviral and of course the HPV vaccine for HPV infection. So yes, the short answer to the question is yes, but your healthcare provider will treat you based on the infection that you have contracted.
Okay. Well, it's great that it can be treated.
Yes.
So getting into contraceptives, what do you believe is the most, or what do you believe are some of the most effective forms of birth control?
Okay. The most effective one, everybody knows the answer to this question, but do we do it? No. So we're going to say it and no options. And the number one answer is abstinence. Stay away from it. If you don't do it, you can't get it. So abstinence, of course, is the best and the safest and the most logical way for you not to contract any STIs or have unwanted pregnancies. So these are birth control methods. So here are the other options that's available to the community at large. We have long-acting reversible contraceptives. These are your that gets placed by a licensed professional. Your contraceptive implants, they go under the skin. These are highly effective in preventing pregnancy if we're talking about birth control methods. We also have hormonal contraceptives, which we're used to, and these are your birth control pills, your patches, your injectables, and your vaginal rings. We have male condoms, barrier method. This is a good one. We also have female condoms. These are the dental dams. That's another good one. We have vaginal patch and rings, as I mentioned before, the injectables, as I mentioned as well. We have fertility awareness methods. And what is fertility awareness? Okay, so this involves a woman tracking her menstrual cycle so she knows when she's when she's not ovulating, so get engaged into sexual activities without having the risk of becoming pregnant. And then, of course, we all know these studs out there, what they do. They do the withdrawal or the pull-out method. Is this the best way? No, it is not the best way. You know, some guys are like, I'm on my A game, but you know what? We all know that this doesn't really work, but it is a way of, it's a birth control method. And some guys really like to do the pull-out method. It is also important here to note that these barrier methods, these methods that we talk about that are effective birth control measures, they do protection against STIs.
Okay. So, speaking of contraceptives, how and where can someone get affordable contraceptives?
Okay, contraceptives can be had these days pretty much anywhere. If an individual wants to get contraceptives, and this is, this country has made this so affordable and so accessible to the general population at large. So we'll talk about a few of these contraceptives, where they can be obtained. We have public health are great. They offer birth control, they offer condoms, they offer IUDs, injectables, and other methods. And again, it depends on the region that the individual lives in. Not every area would have public health clinics or government assistance and all those type of things. So the person needs to be informed in their location, the accessibility to these facilities. We also have Planned Parenthood or family planning clinics. These are great organizations, not-for-profit organizations that can provide these contraceptives. We have community health centers. We have pharmacies and drugstores. Not everybody can afford the brand name drugs, but if it's a generic drug, it provides the same efficacy, and you can get these at affordable cost. We have online resources, but just be wary and be vigilant about online resources. You want to check with your healthcare provider about online medications that you can obtain to see if these things are really valid, if they're efficacious. If they are, they're cheaper cost, sure, then you can go ahead and do that. Then we have government programs, which are great. And at these public health clinics, if they do not have these birth control contraceptives, these government programs are very good at providing birth control for patients or persons who are low income. So that's another really good way of getting it. And then we talk about local non-for-profit organizations. We have schools and people who are studying to be gynecologists, or they have health fairs and stuff. These things are really accessible to them. The drugstore provides condoms and so on and so forth. So they're available at these places.
Okay. So speaking of access, could someone get contraceptives through their insurance?
Yes, there are contraceptives that can be obtained through insurance. We're going to talk about a few of them today. Now, obtaining contraceptives through insurance depends on the type of insurance you have. Not many insurance covers various types of contraceptives for the most part. So that individual should check their insurance policy or call their insurance providers to see what contraceptives are available, the options that are available to them, and to see if there are any cost sharings, which includes deductibles or out-of-pocket copays. So for birth control pills, intrauterine device, contraceptive implants, injectable contraceptives, the diaphragms, and cervical caps, these are generally covered by insurances. Now we have the sterilization process where the man gets a vasectomy and the woman gets a tubal ligation. Now these are surgical procedures and they're usually covered by insurance. If we're talking about condoms, they're everywhere. So generally insurances would not cover such things as condoms. And then of course you have your emergency contraception, such as the Plan B. They are sometimes sold over the counter, and your insurance will sometimes. So yes,
Okay.
insurance.
Okay, so thank you for that information. Moving on to our next topic of sexual health, I wanted to talk about some partner issues. So let's say there was an individual who wanted to get tested for STIs before having sex for the first time with their partner. How would be a good way to bring up this topic?
Is there a good way? The easy answer is no. There's STI is a really sensitive topic to deal with. Even to the most seasoned licensed professional out there, when you talk about STI, it could be a very daunting and intimidating conversation to even initiate. However, if you are in a relationship for the long haul and you're in this for the sexual health of your partner, and both you and your partner, it is an essential and crucial conversation to have. So I would probably say there are a few things that you can do to set the scene when discussing these topics. And I should make it clear here that you got to partner talk about this, because I could say the most beautiful thing in the world, but if you have a partner like, okay, cut to the chase, what do you want to talk about? Well, what is it that you're talking about? Then you're like, okay, let's talk about STDs. And then you have the partner who is like this, okay, let's drink some coffee, let's drink some tea, then we can have that conversation. Regardless of how the conversation is brought up or thought about, it is a conversation that needs to be had if you're engaging in any type of sexual behaviors. So you want to choose the correct time and place. You want to set a scene. So you probably say, hi, Gary, I have something important that I want to talk to you about today. Is this a good time to talk? Okay. All right, we could talk already. And you want to be respectful. So you probably want to say something like, I know you love me and I know I love you, but let's talk about something in our relationship that is important to me and should be important to us. So you probably can talk about stuff like that. It is essential for you to be honest and open with each other, especially when it comes to matters of health and wellness. You want to share your perspective, okay? What is your perspective? You could say to your partner, before we take our relationship to the next level, I think it's important for both of us to get tested for this STI or STIs. I believe it is responsible. There you go. It's responsible. And it will provide us with the information we need to know about each other. Then you want to educate yourself, you want to educate your partner. You tell them about STI, the prevalence of STI, transmission of STI, and all this has to do with having and maintaining good sexual health. Then you lead by example. So leading by example, you say, I just set up an appointment for myself to go get tested. It would be nice if you came along with me and, we could do this together. Because at the end of the day, you're fostering healthy relationships, you're building trust, you're building bond, and you want to know it's sexual health.
Definitely. So let's say an individual does test positive for an STI. How would they bring that to their partner? How would they discuss that?
This is also a difficult one, right? And again, there's no easy answer to this. And this could be scripted as we want it to be scripted. You just don't know how your partner is going to react when they hear about something as sensitive as you having an STI and we're engaging in sexual activities. That is a conversation that can be very challenging. But honesty and open communication is essential both to the person and their partners. So you want to prepare yourself, one. You don't just want to say, babe, I got tested for chlamydia, and that is not the way to go. It's not going to work. So prepare yourselves. What do you mean by preparing yourself? Like me, I have probably go in front of the mirror and try to rehearse, or before somebody, and before your dog or something. Try to prepare yourself as much as possible. So let's talk about some ways. So you gather your thoughts, you process your emotions. That's very important. So after you finish crying in the bathroom, get it together and process your emotions. Okay, so you want to educate yourself about the STI that you just got diagnosed with, or you were told that you had. You want to prepare yourself and know about the transmission, how to prevent it from happening again, and prepare yourselves for any potential questions that your partner may have. So again, choose the right time and place, the atmosphere, set a mood. You don't want to do it while the baby's crying, or you're on the phone, or you just came out of an argument. You want to be vindictive and say, and I have XYZ. That is not the way to go. So you want to be nurturing and, you know, supportive in this process. So choose the nice time and place to get this done. Do not prolong the conversation because we need to get treated, okay? So you want to be direct and honest. Do not byvalve the problem. You want to shoot straight ahead, but be honest and be very direct. You want to express empathy, okay? Now you just told your partner about this difficult news. How do you expect the person to react? Oh, babe, I'm so sorry about this. What can I do? It's not going to go down like that. So being empathetic about your partner's reaction is very, very important, okay? You probably want to say, I know this is difficult news to hear, and I want you to know that I'm here for you. You want to show some support. You want to show that we're in this together. And you probably could say, I understand that it takes a lot for you to absorb all of this in, but I'm here, I'm listening, I'm hearing you. You want to share the results. Okay, so what is it? What did you get tested positive for? Okay, so here comes this is where the rubber hits the road. Okay, depending on the STI, okay, you know, it could be very weird right here. So you want to share your test results. Then you want to offer information, and this all has to do in the preparation phase that we spoke about earlier about the STI, how it's transmitted, where do we get treatment, and where do we go from here. So you want to provide valid information to your partner, and you want to discuss the next steps. After we find out about what's going on, what are the next steps? What we do from here now that we've found out about this? You want to be proactive. You want to say, babe, I've already scheduled an appointment for both of us to seek healthcare professional advice and for us to get treated and all those good jazz stuff. You want to say that. It's vital that both of you take this seriously and seek the medical attention that is necessary. You want to practice safe sexual practices during this time, because in the event that, hey, you forgot that you had an STI, you never got tested yet, you don't want to go ahead and start doing some things and you're not protected, because you're going to get superimposed infection during this time, okay? And then you be supportive of each other. And finally, you have to respect their reaction. Respect their reaction. Understand that your partner may need some time to process the information and may experience a wide range of emotions. Be patient and not judgmental, and allowing them to express their feelings. That acknowledges that you know something went down. I'm acknowledging it. Do not start blaming others. You own it, and then you decide where you go from there.
Yeah, I think that's really important. So thank you for sharing that information. I also wanted to dive in to I guess a situation or scenario where a partner doesn't want to use a condom. What should you do in that case?
This is a big one. This is huge.
Yeah.
If your partner does not want to use a condom, it is essential to prioritize your sexual health and your well-being. You got to communicate openly and honestly about your boundaries and concerns in that relationship. This is crucial because at the end of the day, it's about you and your sexual health. So you have express your feelings. It's okay. Express your feelings about, hey, you don't want to use a condom. Let the person know, you know, I'm telling you what my feelings are. Then you want to share information. Okay, you don't want to use a condom, but let's talk about the things that can happen, the long-term sequelae of not using a condom. You're talking about STIs, you're talking about unwanted pregnancies, and those things of that nature. You also wanted to listen to their perspective. What's the reason for them not wanting to use a condom? There's a reason behind it. We all know the reasons with guys. Hey, it doesn't feel good. I get desensitized and all the good jazz. Like, listen, I know I pull out. You can do all of that, but you can prevent pregnancies, but you still can give me something that I don't want. Okay, so let them give you their perspective as why they don't want to use a condom. Then, of course, you want to discuss testing. Well, since you don't want to use a condom, let's talk about them tested. Let's talk,
Yeah.
if that has already been done. Let's talk about getting tested and of those nature. Then you want to set boundaries. You want to be clear about your boundaries, what you are comfortable with in your sexual relationship. And these things will actually help the individual know where you stand. Then you get on compatibility. If all the options fail and this person decides, listen, I'm not going to use a condom. Okay, so what is important to you, the individual? You want to think about, are we really compatible? So while it's essential to communicate openly with your partner, it's also crucial to consider whether your values and priorities align in this area. A healthy relationship requires mutual respect and consideration for others' well-being as well.
Yeah. So going into the topic of sexual performance, there was a question. It was, I no longer find sex or masturbation pleasurable. Why is that?
Okay. Whew. Various things can happen here. This one, you're with your partner for a good minute, and all of a sudden, or maybe over time, things are not the way they used to be. So there are a few things that can happen here. You talk about physical health issues could be a factor affecting you. Your hormonal imbalances, chronic pain, other health issues, medications. These things can cause you to decrease sex drive, stress and anxiety, depression. These things can dampen your sexual desires. Your mental and emotional well-being can also be a factor in one's sexual experiences. Relationship issues. Why am I not finding sex or masturbation as good as it used to be? What's going on in our relationship? Problems in the relationship, such as communication, difficulties, unsolved conflicts, or an emotional disconnect. Factors that can drop substantially. Fatigue and exhaustion. I'm just tired today. I just can't. Okay. You have sexual trauma or negative experiences. This is a big, big, big one. So post-sexual trauma or negative experiences might affect one's ability to experience pleasure during sex or masturbation. Then we talk about body image disturbances, or you're conscious about your body image. Over time, things are not the same. Your breast starts to get pendulous. You had a baby, you put a few pounds on, you don't think you're that. Okay, happen, and it is happening. So those things, negative body image or lower self-esteem issues, can influence how one perceives and enjoys their own body during a sexual encounter. Lack of interest in the bedroom, or you're just bored. You got to switch it up, do something new. Don't just do the same thing you've been doing for 20 years. So people get bored and they lose interest. And of course, hormonal changes in women over time, or things that can happen abruptly. So those are certain things that can happen to an individual pre-sexual pleasure, or them having pleasure while masturbating.
Okay. So going as a follow-up question, if your sex drive is lower than normal, what's the deal? Or would that relate and correlate to the previous answers?
Okay, so a decrease in your sex drive, I got decreased libido. Those the word out there on the street. The decreased libido is the term that's used. They can have various causes, both physically and psychologically. Okay, so you have stress and anxiety, which we spoke about previously, hormonal changes. So these answers actually interrelate, because all these things can decrease your sex drive. Sometimes a woman who is a little bit more chubby, we already know there are chemical releases in your brain, your insulin resistance, all those things can make you have decreased libido. When these women lose weight and they have good insulin release and the sugars are under control, their libidos go to the roof. And you will hear women speak of that sometimes. You have some medications that decrease someone's sex drive, blood pressure medicines for men, different types of medications for women, antidepressants, antihistamines. Some of those medications can really cause your sex drive to also decrease. Lifestyle factors, this is very important. Remember we talked about fatigability? If you're always hustling, if you're always on the move, you have no time to even do anything for yourself. You think you're gonna be like at my best at performing sexual intercourse? No, it's not. So lifetime factors, if you're not sleeping good, if you're consuming too much alcohol, lack of exercise, and an unhealthy diet, all these things can contribute to a decreased libido. You have medical conditions such as diabetes, thyroid problems, chronic pain. All these again can decrease your sexual pleasure. And again, relationship issues. You have interest, you have issues that's going on, you're not engaged anymore. These things can contribute to lower sex drive. Body image disturbances or lower self-esteem issues. These things again can decrease your sexual drive. Your age, libido can naturally decrease with age. But now with meds, things are a little bit better. People can do prolongation these days. So whereas it used to be applicable in the past, now we have things that we can do. So as age progresses nowadays, your sexual drive can still be maintained. However, we know that age, your libido decreases. And past sexual trauma, which we spoke about in the previous segment.
Okay. So going into that, what do you think would be the problem if an individual starts to say that having sex hurts or it's beginning to hurt? What would you say might be going on there?
Having pain during sex intercourse, well, I guess we should need to differentiate between having pain and sexual discomfort. You having pain during intercourse, that's a problem. Discomfort, you can do body mechanics, adjustments, those type of things. But we can have lack of lubrication that can cause, pain during intercourse. So you have insufficient vaginal lubrication. Alrighty, you have vaginal infections such as yeast infections or vaginosis. You can have pain during pregnancy with this. You have a condition called vaginismus. This is where the muscles of the vagina involuntarily contracts. It contracts, then prevents entering the vagina with ease. It just clamps down. So that's one condition that can cause pain during intercourse, painful penetration, and this could be very, very challenging. You have endometriosis. Some women are diagnosed with endometriosis. This is a condition where you have the similar tissues of the uterus outside the uterus, and this can also be painful. You have pelvic inflammatory diseases that women may have, pelvic floor dysfunction, medical conditions for the women such as fibroids, ovarian cysts, chronic pain. And then you have the emotional factors, anxiety, fear, past traumatic experiences, or relationship issues. And then there is the surgical or post-traumatic factors. What am I talking about? Someone who has had recent manipulation of their pelvis or their uterus, like pelvic surgery or trauma or scarring, may lead to discomfort or pain during sexual intercourse.
Well, that was my last question. You provided a lot of information that I'm sure would be helpful to our supporters, to the community. I'm sure people will take that information and use it as their lives go on. So I really appreciate you for coming today and having this conversation with us.
Thank you for having me, Ms. Brianna. It was a pleasure of help and support to our community.
Thank you. We really appreciate it.
Thank you so very much. You have a wonderful day, and we'll see you next topic, right? We'll speak soon.
Well, thank you. Bye.